Hey, what's going on, good people? Today we're going to talk about something that most men dread talking about: erectile dysfunction. Hey, what's going on, good people? It's your boy James Harris, founder of a movement called Men to Heal, which focuses on men's overall wellness, our mental health, physical health, and of course, our emotional health. And I'm also the author of a book called Man Just Express Yourself, which is an interactive planning guide for boys and men to better express themselves. I definitely appreciate all the parents who went out and got this tool for their young sons. You know, all the spouses got the tool for their husbands. I definitely appreciate all my colleagues who got this in their lobbies or using them as interventions. I definitely appreciate it. And if you want to get that book, make sure you go to Barnes& and Nobles, Target, Walmart, Amazon, pretty much anywhere books sold, including my website, mentoheal.com, www.mentoheal.com. And while you're on my website, be sure to check out my board game, Cheesy Dates. You can order that there as well. Cheesy Dates is an interactive board game for adults, couples, game nights, pretty much interactive fun to get you answering those tough questions or just to get basic date ideas. I definitely appreciate everybody who went out to support that. Also, if you're new here, make sure you like, share, subscribe. I definitely appreciate it. If you've been here for a while, kudos. I appreciate you as well. Continue to stay like, share, subscribe. You help me get monetized. I definitely appreciate it. I don't take it for granted. So, when we talk about erectile dysfunction, a lot of men don't admit that they have it or don't know that they actually have it. So that's why I wanted to shed light on pretty much what it is. So it's the ability to get and keep an erection firm enough during sexual activity. Having an erection trouble from time to time isn't necessarily cause like for your concern, but if erectile dysfunction is an ongoing issue, it may cause stress, affect the self confidence, or just contribute to different relationship problems, between you and your partner. So problems getting or keeping an erection can also be a sign of an underlying health condition that you might need to check out. Or you could be at risk of heart disease. Heart disease is also the number one killer among African American men right now. So pay attention to your body. And depending on where you are within that, your sexual activity as well. So there's a couple different symptoms within erectile dysfunction. So, of course, you got the erectile dysfunction symptoms that might include trouble getting an erection, trouble keeping an erection, or even reduced sexual desire. A lot of men don't like to admit that they're hyposexual active or hypersexual active, so it depends on where you are within that spectrum. So pay attention to those signs and symptoms. And you might want to just figure it out because if not, you probably want to see your doctor. And to be honest with you, hopefully you're getting your yearly physicals. That's a whole nother topic. It's a video on here if you need to check that out. But your primary care is definitely a good place to start if you are having erectile dysfunction issues. Definitely make sure that you make that appointment with your doctor. If you have concerns about your erection or you experiencing like sexual problems such as premature ejaculation or delayed ejaculation as well, those things are definitely cause for concern to see your doctor. And also, if you have diabetes or heart disease or any other health conditions that might be linked to your erectile dysfunction, you might want to consult with your doctor as well because they probably can prescribe you something or assist you in those life changing things that you probably can do. You also have symptoms with erectile dysfunction. Like, it's so many different causes for it, so just make sure you're paying attention to it. But of course, those lifestyle changes definitely have to happen between you, your partner, and probably your surroundings as well, because a lot of environmental factors can contribute as well. So different causes though. Male sexual arousal is definitely a complex process. It involves, of course, your brain, your hormones, your emotions, which a lot of men don't like to talk about, different nerves, different muscles, and of course, different blood vessels, not throughout your entire body, not just in your genital penile area. Erectile dysfunction can result from problems with any other symptoms, pretty much throughout the day. Likewise, of course, you got the stress, you got the mental health concerns, which can make these causes and symptoms worsen depending on where you are if it's untreated. So if you do have additional stress from work or just societal pressures, just make sure that it's not contributing to your actual time to please your partner. Sometimes a combination of physical and psychological issues can cause erectile dysfunction. A lot of people don't know that. Of course, many years ago, people thought the man and the body was separate, but of course now, within the last 5 to 10 years, a lot of people know that the man and body is definitely connected. So a lot of issues go hand in hand, the physical and the psychological. Um, it might be a sign of your sexual responses due to anxiety, uh, with the lack of maintaining an erection, so that can contribute to it too. So the results of anxiety can lead to worsen your erectile dysfunction. So make sure you're paying attention to those things. In many cases, erectile dysfunction is caused by some physical, whether it's heart disease or clogged blood vessel, high cholesterol. So make sure you get your diet under taken care of. High blood pressure, of course, diabetes, and obesity can contribute to erectile dysfunction. So make sure that you are having these conditions looked at, getting your blood pressure checked, all those things that you should take care of within your physical. And of course, there's a couple other diseases that can contribute as well. Like if one has Parkinson's disease or multiple sclerosis, of course, certain prescription medications can contribute to the lack of having an erection or maintaining an erection. And if you use tobacco too, a lot of people don't know that smoking or using tobacco products, vaping, can contribute also to erectile dysfunction. So make sure you pay attention to that. Alcohol, so many different substance uses can contribute to erectile dysfunction. If you have a sleep disorder, that also can contribute to erectile dysfunction. Make sure you also getting your prostate cancer and prostatic glands checked as well when you do go to your physical, if it's that time for you, depending on your age. Surgical, any issues or injuries that you have within your pelvic area or your spinal cord area, those definitely can be causes of erectile dysfunction. And to be honest with you, a lot of men have low testosterone and didn't even know it, so that can contribute also to erectile dysfunction. But if we're moving forward and talking about, some of the physiological causes of erectile dysfunction, again, we have to admit that the brain plays a key role into triggering different physical events that can cause erectile dysfunction, depending on how you feel when it's time to perform that sexual act. You might be excited, overly excited, or just thoughts of having that act performed, so that can contribute to it too. A number of things interfere with the sexual feeling or cause worse things to happen during this erectile dysfunction period. So make sure that you're not having symptoms of depression or anxiety or any other mental health conditions that can cause additional stress. Relationship problems due to stress, poor communication, or other concerns with your partner can also contribute to you having erectile dysfunction. So hopefully you're in a situation or relationship to where you and your partner can converse or have dialogue about these things. So of course you wouldn't feel embarrassed, or you wouldn't feel like you're not validated, or you don't have the support that you need from your partner, because that can continue to assist in the declining of your sexual dysfunction, whether that's arousal, maintaining arousal, or even not getting aroused at all. So make sure that you are in a situation to where you can get their support from your partner. Just be open and honest, have those conversations. There's a couple different risk factors that contribute to erectile dysfunction. Of course, as you get older, erections may take longer to develop and might not be as firm as they used to be. It's a difference between being 20 years old and late 40s rather, so, and of course, again, it goes back to your lifestyle, because you can be an active, healthy 40-year-old that's engaging in not only the psychological well-being, but of course your physical well-being, proper diet and nutrition, proper exercises. Don't just be lazy, because those things can definitely have an impact on your overall wellness and health, not just your physical or your psychological mental health. You might need to be more direct. Touch your penis to get it or keep the erection. Don't be afraid to do that. Know your body. It's yours. Make sure you're comfortable. And of course, we already discussed medical conditions. Again, the diabetes, the heart disease, tobacco use, all of those things can contribute, which restricts the blood flow to the veins and the arteries over time. Those things continue to happen. So if you do have a chronic health condition, it can lead to that erectile dysfunction. So make sure that you are getting those physicals and taking care of your body. And again, being overweight, or not even as far as being obese, but just being in a situation to where you're not physically fit. That doesn't mean skinny, or that doesn't mean you're too big, but just being active, healthy, moving around. You don't get as winded. You active, you chasing your children around, or you going to the park, you bowling, you lifting weights, you running. Those different things can assist you. Of course, we already talked about certain medical conditions. Make sure you're getting your prostate looked at. When is definitely that time to ensure that you don't have any cancers or any other issues around that region specifically. And of course, if you had an injury in the past, that probably can contribute to nerve damage or arteries within that erectile area. So those things can contribute. And a lot of people don't know that certain medications also can contribute to erectile dysfunction, whether you're on an antidepressant or antihistamine. Like if you got high blood pressure or taking pain pills, or some of those things, those blood thinners can contribute to the lack of erection or you not getting an erection. So of course, make sure you're paying attention to those things. And again, don't ignore the fact that you potentially could have stress or certain anxiety surrounding this that can contribute to the lack of erection, contribute to your erectile dysfunction. Drugs and alcohol use and any other substances, make sure you reduce those if you do have erectile dysfunction. There's a couple of different ways that you can prevent it. The best way to prevent erectile dysfunction is make healthy lifestyle choices. Of course, that can mean anything. So changing your diet, increasing your exercise, increasing your water intake, having a low stress life. Work with the doctor to manage your diabetes or your heart disease, or if you have any other chronic condition, that definitely can be beneficial. See your doctor regularly for checkups, whether that's yearly or biannually, to get those physicals, to get your blood drawn, labs and all those things should definitely be benefiting. And again, if you are smoking, make sure you stop or reduce it. Limit your alcohol use and any other drugs that you probably use. And of course, increase your exercise, your overall nutrition. Those things are beneficial to you. Take steps to reduce your stress, of course. Get the anxiety, depression, or mental health support that you probably need if you are within that area. If you don't know whether it's physiological or psychological, then of course, try a well-rounded approach, and there's so many different treatment options that you can do depending on the cause or the severity of your erectile dysfunction. So the underlying health conditions might have various treatment options. It depends on where you are within that spectrum. Of course, you can take things orally. Medications, of course, for your erectile dysfunction. You probably see on the commercials all the time, whether it's Viagra or Cialis or Stendra. It's just, a couple of different pills that they push. So it depends on where you are. All medications can enhance the effects of the nitric oxide, a natural chemical in which your body already produces. It pretty much relaxes your muscle, of course, within the penile area. So if you want to take that medication route, then that's up to you. But of course, those things have side effects. You got to do your own research. Make sure you're consulting with the right people. This increases the blood flow to allow that you to have this erection response, in which is sexually stimulating to not only yourself, but of course your partner. So testosterone replacement is another one that you can do. Some people have erectile dysfunction that might be complicated because of lower testosterone. And of course, testosterone is already a chemical that's produced within your body, so it could be an imbalance. You could not be producing enough depending on where you are, and of course that can be a lifestyle change as well. And of course, in those cases, you can have a testosterone replacement therapy, which might be recommended depending on your physical yearly. It might be something that they can see within your labs, or just relationship between you and your doctor. And of course, if you want to add an extra razzle dazzle to it, you can get you a penis pump and start to reclaim the knowledge and the relationship between you and your body. So penis pumps, of course, it sounds weird. Women have mad toys, so it all depends on where you are. And of course, this can be embarrassing, or you just feel like you shouldn't have to, but it depends on, again, you and your partner, how much you're trying to reach that sexual gratification. So penis pump is definitely like a vacuum erection device. It's a hollow tube with a hand-powered battery pump. And, it's a couple of different ones. You can research them for yourself. The tube is placed, of course, over the penis, and then the pump is used to suck the air out the tube, pretty much. Just create the vacuum suction that pulls the blood into your penis, so that way you can have the erection. Make sure you increase your exercise. That can help you increase your cardio. A lot of people take cardio for granted. Um, do some calisthenics as well. You can do those things within the house. You don't have to go to the gym, or you don't have to buy this extensive weight equipment. You can just do push-ups, sit-ups, jumping jacks, mountain climbers, burpees. Those things are definitely keep the blood flowing throughout your body. Squats, um, so make sure that you're doing those things, because recent studies, of course, show that exercise specifically, depending on where you are, whether it's moderate exercise or vigorous exercise, including aerobics, can improve erectile dysfunction. So be as active as you can. And it doesn't have to be like a strenuous workout. It can be a regular exercise. I'm telling you, like, just do what's best for you. Pretty much, you want to stay as active as possible, and have your blood flowing throughout your body as natural as you can. The more you sit down or the more you're relaxed, the more that you are not as active, of course, like your blood doesn't flow throughout your body as well as it needs to. And of course, if it's on those psychological factors, whether it's stress or depression or anxiety, you can get those. You can get counseling. Um, of course, a lot of men probably potentially be embarrassed to have a counselor if it's not a man. If you got this counselor, she's attractive, you 6'2", and you don't want to tell her that you have any sexual function issues. So, of course, get you a counselor, get you somebody who's non-biased and who can assist you in reducing your stress, anxiety, whether it's depression or if you want to talk about your erectile dysfunction. So hopefully you and your therapist have that relationship to where you're no longer embarrassed. You guys got that cohesive bond, that collaborative experience to where it's good. And of course, you can try alternative medicines, but just make sure that they're FDA approved. Make sure that they have warning signs and different things that you can take. Make sure, because of course they got herbal Viagra, and it could be potentially harmful if those things are not listed on the label. So make sure you do yourself due diligence and do your research. Be active and be healthy. So that was erectile dysfunction. A lot of men have it, don't know what it is. So listen, hit me up if you got any questions. Send me an email if you don't want to comment publicly. But we can get this together, man. So don't be too hard on yourself. Pun intended.